Today we will talk about many topics in the male genital tract. First of all, we will talk about the prostate. The prostate is a gland, غدة يعني, that has a glandular part, which highlighted here, and we have secretion within it, which is the corpora amylacia. And in between the glands, there is a stroma. So that two components of the prostate gland. We have the stroma and the gland. The glands, it has two layers. The normal glands, it has two layers. The luminal layer and the basal layer. The basal layer اللي هي من تحت consisting of myoepithelial cells. Myo شيء بينقبض. So that contractile thing. The myoepithelial layer presence indicating this is benign. لأنه one of the first signs for malignancy is loss of the myoepithelial layer. Also, the presence of the intervening stroma is good and indicating there is a benign condition, it's not a malignant. This is the normal, and this is the bluish thing is the corpora amylacia, which is secretions within the prostate. Here you can see gland with bilayer, which is luminal and basal, and in between there is a stroma. But the stroma is infiltrated by lymphocytes. So that lymphocyte indicating what? Chronic thing. So that chronic inflammation of the prostate is called chronic prostatitis. Enlargement or the neoplasms of the prostate, we have benign and we have malignant. Benign, which is called NPH, nodular prostatic hyperplasia. ليش nodular؟ لأنه this is a nodule, this is a nodule, this is a nodule, also this is a nodule. So that it's nodular prostatic hyperplasia, and it will involve all the gland. So the diffuse enlargement, nodular enlargement of the prostate, it's called benign thing under the microscope, nodular prostatic hyperplasia. ليش hyperplasia؟ شو يعني hyperplasia? Increase in the number. So that increase in the number of glands or increase in the number of stromal cells, so that this is hyperplasia. In this picture, you can see what? Two components. We have glands and we have stroma. And here is a nodule. So that this is a nodule, and with its enlarged prostate, so that it's called nodular prostatic hyperplasia. This is a secretion, which is the corpora amylacia. And بنلاحظ اليومن of the prostate gland, it's serrated, يعني مسنن في زي الأسنان داخل اليومن of the prostate gland. So that also the serration represented within the lumen of the prostate gland indicating its benignicity. This is a higher prior view. This is the corpora amylacia, and here is serration of the epithelial surface. And on higher view, there is also the myoepithelial lining. So that this is called nodular prostatic hyperplasia. حكينا بالnodular prostatic hyperplasia there is a diffuse enlargement, but here you can see a prominent nodule within the prostate. So that this is the first thing to indicating is a malignancy. Also, it will involve what? The central part of the prostate. And on the microscopic examination, appearing to be have prostate adenocarcinoma. Prostate adeno ليش? Adeno glands. So that prostatic adenocarcinoma. This is a cut sectioning of the prostate. Here is the central part. هون في عندنا اليوريثرا. And we have multiple nodules in the central part. In general role, the nodular prostatic hyperplasia, it will appear central. بينما prostate cancer, it will appear peripherally. So, يلي better prognosis بناء عليه central لأنه بيعمل obstructive symptoms early presentation. It will compress on the prostate urethra so that it will cause obstructive symptoms and discovered early. بينما البروستاتيك adenocarcinoma is poor prognostic. ليش؟ لأنه it will arise from the peripheral part. So that late presentation يعني بيكون الديزيز صار عنده فترة طويلة so that it will present with bone mets in good percent of the patients. This is a high view of the prostatic carcinoma. Here you can see corporal amylasia. We have intervening stroma, but in the left side of the picture there are back-to-back glands, loss of the stroma, first thing. So that back-to-back glands without stroma, this is most likely malignant. Also, there will be on higher view appearing what? Rounded tubules that will be back-to-back without stroma and without the myopithelial layer, بدون حكي, which indicating there is a malignant potential. In general, the prostatic adenocarcinoma, they are graded عشان حدد أيان أفضل which the route of treatment. We have what we call Gleason grading system. The Gleason grading system بناء على إيش؟ tubular formation, glandular formation. كلما كان في عندنا rounded glands أكثر كلما كان الجليزون grade أقل. لأنه separated بنسميهم you can draw a circle. تقدر ترسم دائرة حول كل gland مستقلة بحال ذاتها ولكن back to back. بينما لما يصيروا الجلاندز يدخلوا على بعض ويفتحوا على بعض بصير ايش اسمه؟ grade 4 Gleason grade. Gleason grade it's two part. First digit, second digit. أول إشي the most common, the worst, and the second most common. مثلا 3 plus 3, 3 plus 4, 4 plus 3. يعني أي أفضل 3 plus 4 ولا 4 plus 3؟ الأولى لأنه 3 plus 4 لأنه مو أكثر إشي موجود عندي 3 بينما 4 plus 3 أكثر إشي موجود عندي 4 which is worst prognosis. In this picture you can see no glands formation. The الخلايا يعني they appearing in rows so that this is what we call it Gleason grade 5 which is the worst Gleason grade. In this picture you can see a testis, normal testis, but this is smaller testis. It is atrophic testis. So that there are multiple causes of the testicular atrophy. تعرف التستس, it is stimulated by hormones so that the hypopituitarism decrease in the drive in the central nervous system could cause bilateral atrophy. Also what? The presence of the cryptorchidism أو سموه الخصية المهاجرة. It will lead to atrophic testis. Also infection of the testis like in mumps, there will be atrophic testis.
Ischemia.
Ischemia also it will lead to atrophic testis. مثل age اللي بصير عنده testicular torsion. A long period undiscovered it will lead to atrophic testis. Here is normal parenchyma of the testis ولكن هون في عندنا nodule, abnormal nodule. So that under the microscope appearing to be seminomatous. In this picture you can see there is a capsule that will separate between the tumor and the normal prostate. عفوا التستس. Testis is responsible for spermatogenesis. There are multiple steps for spermatogenesis. Primary spermatogonia, secondary spermatogonia, spermates and spermatocytes. Here you can see the maturation. This is normal testis. But adjacent to it, there are islands of seminomatous cells separated by lymphoplasmacytic infiltration. So that this is high power view of seminoma. In this picture, you can see mixed type of testicular carcinoma. We have the teratoma. شو يعني teratoma? Teratoma هو tissue not belonging to the side. يعني testis ما فيها cartilage and ما فيها spindle cells إلا بالستروما. ولكن when it's increased, so that this is teratoma. And in this this is small round blue cell tumor called embryonal. So that 1 plus 2 it's called mixed teratoma, embryonal carcinoma, testicular tumor.